Welcome in, y'all. Welcome in. Welcome in.
Hello.
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 Greetings to you all. What's that? How's
Greetings,
everybody doing?
greetings.
How's everybody doing tonight?
Good.
Doing well. How about you?
Doing great. Doing great.
Hmm.
We're just gonna give people about 5 minutes to get in.
Sure.
It's 7:01. I know people are trying to hurry to their computers and get to this talk tonight. All right,
I'm excited.
I've been bigging you up. I'm like, y'all gotta be at this one. Last week was crazy. It was so good. I was like, y'all gonna want to be at this one. So look, if you missed last week, you need to be at this one. So
I'm excited.
I've been telling them about you all week. So they coming. They
All
flowing
right.
in. They flowing in.
That's what's up. Love it. Love it. Love it.
Yeah, here we go, Pierre. All right. So the person whose iPhone, I don't know if you could change your name so we know who you are. Okay. I'm sending a little dings to my people, like, come on now, come on in here.
Come on in the
Come
room.
on in the room. Ari has arrived. She in the building. All right, let me let this other young lady know that you're here. Let's see, who else? Pierre's here, Desiree's here. Oh, Michelle. Let's see if she can make it. I'm trying to just think of everybody.
How's the challenge going? You started it on the first, right?
Well, y'all can tell
Yeah.
Ari how things are going. Tell her what
Everything is
y'all
going
think.
great.
Yeah.
Good. Is this your first challenge or is this your second, your third?
I think this is my first.
This is your first? Okay.
Mhm.
All right.
Mhm.
First with a group.
First with the group.
Yeah.
Mhm. How about you, Lori? She might have walked away.
Mhm.
It's my second.
It's
Oh,
your second. Okay. All right. And JP?
It's going okay. Doing well, doing well.
Good.
I'm trying
Good.
to change my name.
Mm-mm-mm. I'm just texting folks, y'all. So we got 1 more minute, then we're gonna get crack-a-lack and we're gonna get started. I just don't want people to miss, like sometimes things like this escapes people's mind. They be,
Hmm.
Hmm.
so I was like,
Yeah.
let me send a quick text.
It's a lot going on.
Yes, it is. All right, so I just sent a few text messages. I'll continue as you start. All right, y'all, we're gonna get rocking and rolling. We're gonna get rocking and rolling. We have the lovely Ari Johnson, who is coming here tonight to talk to us about hydration, IV hydration. So it's a little bit different. And I wanted you guys to hear from an expert, Ari, actually one of my dear friends from college. This is his beautiful wife. And so he told me that she has an IV spa, and then we started talking. I was like, "Ooh, you gotta come talk to the lady." Ooh, it was just a beautiful conversation. So I'll let her take a moment to introduce herself, her background, why she's decided to do this work. As you can see, she's a registered nurse, bachelor's in nursing. And in addition to that, has expanded her practice to offer IV therapy. She has her own spa. So without further ado, I want you guys to meet and chat with Ari Johnson. Ari.
Hey, my pleasure. First of all, I am so honored. Thank you for asking me to speak to your group. I am very honored to share. What a awesome challenge. Like to take the time, I just want to big you up because you are so community focused and you are in the community. You are boots on the ground. Okay. And so I'm just grateful for you and what you do in the community and for asking me to come and speak to your group. So I'm Ari Johnson. I'm a registered nurse. I've been a nurse for a long time, over 20 years. I've worked in just about every area that, I don't want to say every area, but every area that was near and dear to my heart. I started off, I'm from Buffalo, New York. I started off as a community health nurse, is what they called it way back when. And home health nurse, you may know that, hospice nurse. And so I would go into the community, go in people's homes, go in their refrigerators. I wasn't scared. I'd be like, what you eating? What you drinking? That has always been since I was 19, 20 years old to be that kind of nurse. Um, I grew up in Buffalo, and I think it's important to share where in Buffalo I grew up in. If you remember the massacre that happened in 2022 at a shopping store in Buffalo, New York, that was targeted just for a underserved African American community. Well, that's where I grew up. And that also was my territory as a nurse. And I chose that territory because usually they don't let you work, corporately in the area that you grew up in because they figured you're going to be too close. All the things that people are afraid of us getting in there. I fought for that territory because I knew it was underserved. And just think about it, that was over 20 years ago. There was a food desert. In 20 years, it's still a food desert because that shopping plaza that person went in and killed people was the only supermarket for miles in that area still. And that's the area I grew up in. My grandparents, everybody lived in that area. So to see that, fast forward 20 something plus years later, it's still a food desert. There's still not enough, right, to sustain people the way that they need to be. That was my heart back then, right? To be able to teach people what to eat, how to eat, where to get it, find resources. I think I've done that probably my whole adult life. So fast forwarding now here in Georgia, being able to do that same thing, but now having a little bit more to work with, it ignites my life. Like, so during COVID, I started this business. And how I started it, I actually was going to a store, and next to that store, there was an IV hydration company, business, storefront. And I had never really heard of that. Like I had colleagues who would start IVs like on movie sets and private pay and things like that. I knew that it could be done, but I'd never seen like a storefront. So I went in and started asking questions. And I asked the manager, I was like, hey, what are you doing? I didn't tell her I was a nurse. I was there like maybe I might want an IV. Someone else was also in that uh, foyer that had come in. She looked at me and was like, oh, well, and started talking to the other people that were white and told them all about IV hydration. Like she was like, she wouldn't even explain it to me. So I waited because first of all, I also worked for the state. So I was also a state surveyor that I was the one that would go to hospitals to find out where they were deficient and write them up. So I said, oh, she got the wrong one today because now I want to find out how is she doing this and does she have a doctor's order? So now I'm not just a consumer. Now I'm putting on a different hat since she wanted to ignore me. I'm gonna find out what you're doing, right? So um, she got back to me and she explained to me what the business was. And then I started asking her questions. And then she was like, oh, what do you do? And I said, I'm a registered nurse. So she was like, oh, and she was very apologetic. And I was fine. But I had also started thinking that if you did that to me, how many other people that look like me are you not telling them the full benefits of being IV hydrated and what it can do the way that you just explained to this other group of people? So at that time, they were looking for a nurse. And she was like, oh, we need a nurse. Can you come in? That's okay. Let me think about it. I did. And I took that job with the thought that I'm going to learn how you do so well so that I can offer it to a community that's underserved. Because the way you treated me, I'm sure I'm not the first person you did that to. And I'm gonna make sure that people who need this as well in my community understands what it is. So that's how Spa Citrine was born. During COVID, I didn't have this. I was concierge. And so taking my home health background of going into people's houses, I started the business where I could be concierge and I could go to people's houses and start IVs if they needed it, whether it was on their job, in a gym. And I, again, didn't even know that this was a real thing to be able to hire myself out as a nurse with a doctor's order, right? You have to have the protocol, right? And have all these things in place to protect my license and to protect people that I serve. But once I figured that out, because there was no blueprint at the time, but once I had to figure that out and go through Secretary of State and talk to attorneys and everything, I was able to offer that. I offered it. I paired with physicians around Atlanta. So if they had someone that was dehydrated, whether it was from migraines or menstrual cramps or a hangover, whatever, I partnered with area physicians so that I would be the person that they would call to go and start an IV if the person was appropriate, if the patient was appropriate to get it. That grew from 2020 until last year, 2024, grew the business. And now I knew, and I also knew that I wanted to offer more because what would happen is I would go into people's homes and I wanted to give more. Like I was able to give the fluids, right? That was easy. I could stick you with a needle, give you the fluids, be on my way. That's fine. But I knew there were stressors and they needed to relax. And I'm like, sometimes you can't even do that in your home. I want to be able to bring them out of there where I can offer the relaxation, the spa, the whole package that I saw again, so many other establishments and people being able to enjoy. So that's how Spa Citrine was born. Citrine is a jewel, it is a crystal. It is known for its properties of healing, joy, peace, prosperity, and that's how the name Citrine was born. That's that. All right. Do we have anybody else join? All right. So I am grateful for you all, Lori and Jody and Pierre, and of course you, Dr. Natasha. So let's get started.
Okay.
All right. Hydration. And why does it matter? I think that it's a term that's we've heard probably our entire lives, right? As someone said, "Oh, she's dehydrated. Oh, he's not hydrated enough. This is why this is happening." But what is hydration? And understanding that it affects our emotional well-being, our spiritual well-being, our physical well-being. Hydration, we are 60 to 70% water. And that number, you'll see it. You can Google it. You'll see 60, you'll see 70 somewhere. I've seen 80. I don't know about 80. But we are at least 60% water. That's a lot of water. That's a lot of water to neglect on a daily basis. If you think about that, if you are more water than anything else and you don't replace it, we wake up in deficits. We wake up dehydrated. Because what's the first thing you do when you wake up in the morning? What do you do?
MP.
You go pee.
bathroom.
Yeah, urinate.
Yep. And if you've had anything to drink the night before, you could urinate a whole liter. So we wake up most often in deficit. So what does water do? It's real important of how it transports. It's important for every function in the body, from carrying a baby to transporting nutrients from one part of the body to the other. The brain needs water. It is encapsulated in water. So without these things, without having water, every body system will fail. So I always like to stop here and let that sink in because I tell people all the time, I tell my patients all the time, how much water do you drink? Oh, girl, I don't like water. And I'm like, I get it. Some days I don't want to drink water either. But when I think about all the different parts of my body that needs water, I'm like, stop playing, right? Like I have to drink. I have to drink. It supports digestion. It does everything. So I wanted you to see this. So hydrated versus dehydrated. See how hydrated, see how the blood flows through our veins, arteries, and how dehydrated. Let me see if I can play that again. It may not let me do that. Let me go back. See how slow dehydration is? It gets sticky and it can't move. And so if you think about all the different places, every part of your body has blood, right? So if you don't have enough fluids to help that push through like that, you're going to get sticky blood, is what my acupuncturist calls it. It's going to be sticky. It's not going to move through. And that is a cascade of problems. High blood pressure comes from not having enough fluid to go through, to push the blood through. Heart disease, edema, swelling, acne. I mean, the list goes on and on, right? So water carries vitamins, minerals, glucose, sugar, all through the blood cells. This is all it does all day. It cushions the brain. It prevents us from overheating. If we don't have enough water in our body, if we get hot, we're like a car. We're going to overheat immediately. Electrolytes, so like your sodium, potassium, chloride, magnesium, all of that regulates. It all depends upon the other. How much sodium, how much potassium, how much magnesium. If you have any imbalance, because remember in the beginning I said that what is hydration? It is the balance, right, of fluids and electrolytes and minerals. So if you don't have enough water and you don't have the right amount of nutrients, of electrolytes, that's what causes dehydration. And we'll get into that a little bit more. Everybody still with me? Yeah. Okay.
Yep.
All right.
Yes.
All right, let's debunk some of the myths about dehydration. Have you ever heard this one? If you drink, should
That's
drink
what I've
half
been
your
telling
body.
them. I've been telling them
Oh,
that.
okay.
I mean,
It's not totally wrong, but there's a better way to gauge that, and I'll tell you why. And I've heard this my whole life too. So it's out there. It's not totally wrong, but let me give you a better way to gauge how much you can drink and why. I'm moving my screen around here. So I say no to not use that because it really, everybody is different. I can't even say that even the recommendations that I'm going to give you, they are a guide. But I feel like because I've had enough people come here and just in my career and lifetime to see people who use that and they're underhydrated or overhydrated. It doesn't give you a good gauge to do that. So people, right? Climate, hot versus cold, whether you're really active or you're really athletic, your health status, the way we lose fluid, the way we sweat. I'm a sweater. You know, I remember when my kids were teenagers, my son was a sweater. My daughter never sweat. She hardly ever broke a sweat. So everybody is different, right? But if you go by that measurement, you may consume under the amount your body requires. So look at this. If you're 145 pounds, that would be 72 ounces, 9 cups, about 4 of those small 8-ounce water bottles, maybe, right? 2 liters. But what's really recommended is the 2.7 liters, 91 ounces, 11 to 12 cups for a woman. You see how you can be off on that? Like I said, it's not terrible. At least you have some type of guide. But I like to recommend this one so you can have a ballpark. And I'd rather you be closer this way than underhydrating yourself or overhydrating yourself. Does that make sense?
so can I ask a question?
Yep.
So let's look at the two distinctions. So if you have someone who is, let's say 200 pounds, and they had to do 100 ounces of water according to the half your weight in body ounces, your half your body weight in ounces, excuse me, guideline.
Mm-hmm.
versus this, which is, and they're over 19. So that person who's 200 pounds, would they just do 91 ounces of water?
They can. And also, we'll talk about this too. It's a cascade effect. It's not just what you drink, but if you have some watermelon, if you have some cantaloupe, if you have cucumbers, that counts. So, water toxication, have you heard that of having too much water? Rarely happens, and I'm not so worried about that, especially not with y'all. But there are some people who go by these strict guidelines and they're like, oh my God, I got to drink all this water. And then what happens is that, let me get to the next slide if that will help. Let's go over these first and then I'll come back and circle around. These are the recommendations. Just take a look. And I'm going to send you Natasha, I'll send you this presentation so you can share and some handouts. So this is what is recommended. Men, 15 to 16 cups, women, 11 to 12 cups. Adolescents, you see that down there. But also remember, yeah, your beverages, your fruits, your soups, your jellos, all of those still count. Okay. So, let me move on. Okay, I don't want to go there yet. Let me go back. So to answer your question, and tell me your question again to make sure I heard you correctly.
I guess my question is, it sounds like this is more fixed, and this is me, the math person.
Mm-hmm.
As long as you are over 19 years old, doesn't matter what weight you are, whatever, you have to do 3/4 of a gallon, according to this recommendation.
Mm-hmm.
Whereas the half your weight in body ounces that I've heard from various physicians
Sure.
is varies based on the person's weight. It doesn't talk about their age, but it's varying based on their weight. And then there is a cushion if they are active, then there's a certain percentage that they would drink more than that to kind of, take care of the fact that they are losing water as they are active, weren't running, working out, etc.
Mm-hmm.
This seems a little bit more fixed than the other ones, which vary based on how much you weigh and your
It
height.
does.
Hmm.
Yeah. But the room to not hydrate enough, I've found, is greater. Because again, remember that example I gave you that and it's just a few ounces off, right? But if you play with these numbers long enough, and I've sat down and done that even with my weight loss clients, they are underhydrating themselves when they use this. You can use this as a guide. However, keep in mind that if you are 145 pounds, it's saying that all you need is 72 ounces. That could work for you. So I'm gonna jump ahead too and tell you, how do you tell if you're hydrated or dehydrated? And really, that's what it boils down to, right? You can do this. I'm not saying it's wrong, but there's also, I think, a greater chance of error, just in my experience. However, if you use this as a guide, then I think throughout the day, okay, am I anywhere close to where I want to be? And you can do the same thing with with the weight. Am I anywhere close? So that example I gave you, I think it was 72 liters versus 91, 72 ounces versus 91 is 20 ounces. It's another couple of cups, right? You're not going to be that far off. I just get concerned about people who, if you use that and you're like, okay, I'm done for the day, and you're way under. Does that make sense?
Yeah.
Yeah. So I think you can use either. Like I said in the beginning, it's not wrong, but I think it's a myth. And I have studies, and I can send you some of the published studies that I've looked at that say this is a better guide than going by weight.
Got it.
Okay. It's because the other part of it is, if, let's say, let me just calculate real quick. If somebody was, it's like you said, 250 pounds, right? You divided that by two, then that's 125, right? So look, here we go for a man. If he was 250 pounds, boom, this would be right here for him, right there. But what if he's not? Right? So I think that this is a good guide. And I think that if you decide to go by weight, keep this in your back pocket and see if you're anywhere near it. So you can have both. Fair? All right. So how do you,
So
I'm sorry.
this is Lori. How are you?
Hey, Lori.
Question, going back to that, figuring out the
Yes.
water.
Uh-huh.
To me, it looks like if you're on the, you're 145, I am not close to 145, right? If you're 145 and you'd be drinking less, but because I should be drinking 110, I'm like in the 220 area. I should be drinking 110. So and when you were doing your first slide, I don't even think I told Dr. B, Dr. B this. Chef B, I had sticky blood. I went to go draw my blood for literally for my physical, and the person drawing was like, "Oh, your blood is really sticky." Like, and she didn't say what it meant, and I did not know what it meant at the time. I now do. Like, so it was really interesting. You just said that, so now I know I had sticky blood because I did not drink water, which is why I'm in the challenge. So, but if you're on the higher side, should I go above that 90? Or is that like if you're lower, I can see maybe you have to drink more. But how about if you really are? I'm really trying to get to the point where I can try to get healthy. I like to not stay on 220. My goal is to get below that, but to where I am today, that's what I've been shooting for. And that's what I'm just trying to understand a little bit.
Sure. So you're also going to go by how you feel. You're also going to go by some of these other things I'm going to show you, like what does it look like when you're dehydrated? What do you feel like when you're dehydrated? And really, that's what I'm trying to say. Like we have these guidelines, right? They're guidelines to help kind of keep us close to where we should be. But the ultimate, there are some days when I know I am nowhere near 91 ounces, but I go by how I feel. If I feel sluggish, if someone tells me my blood is sticky, if I feel like I got a headache because blood can't get through to my brain and circulate, right? And I've got a headache, then it doesn't even matter where I am. It depends on how I feel. Have you ever found that you're drinking and you feel better or you don't feel any better? You don't see a change? Has that happened for you?
Drinking the water definitely makes me feel better.
Okay.
I don't, I'm still working on 110. I have not gotten there. I'm still staying around somewhere like in the 90, 80 to 90. And I am feeling better. I still think I need to drink more water, but personally,
That's
at the
good.
moment, so yeah.
Yeah. Well, congratulations for at least getting to where you are. Like,
Right.
again, I'm not telling anybody to beat themselves up when you're not getting here, but use it as a guide, like, in the morning. And so I carry this around all day, trying to get to my gallon. You see where I'm at today, right? Um, but it happens. But you do the best that you can. And again, you use this as a guide. So. Did that answer your question, or are you looking for more clarity?
No, I'm good. Thank you so much.
Okay, all right, all right. Anyone else want to stop here while we're here? No? All right, we'll keep going. So how do you know?
I'm sorry. I do. Please
Okay,
forgive me. Can
no
you
worries.
hear me?
Yes, I
I'm sorry.
can.
I lost the signal. I had to stay outside. I'm glad I'm here to catch this one. I missed the first one. So I'm here, and this is informative. I do, and Chef B, my first 14-day challenge that we did, I'm actually going for the 21 days. And I did 14, and then I went an extra week. I may have been consuming more, well, probably now based on the weight, I was probably consuming more water than I should have. So this go round, I'm doing just the minimum, you know. But what I experienced in that extra week was everything was okay until I was just like, I felt like I was just operating on sludge, like my energy level just dropped completely. I could hardly walk at work. I was just like, what is this? So then I went to the doctor. So some of my levels were down. I lost weight. I guess when you're consuming water, that's what's going to happen. It's easy to lose weight. Okay. So, I consulted up some people, and I think that I wasn't like what's your take on eliminating, making sure that you're eliminating, because you can be purging toxins, but the body's not eliminating the toxins, right?
So, well, if you're eliminating and you're eliminating often enough, you should be urinating frequently throughout the day. You should have at least one bowel movement per day, and that should be eliminating toxins. So, is that not what you? I'm.
Oh yeah, it wasn't a problem. The urine was
Okay.
clear.
Okay.
Everything was good until that week. I was just like, I had to stop because there was something going on.
Okay. So
Yeah,
you were so
now I'm okay.
okay. So you were
Mhm.
still drinking water, but you were still sluggish. Is that what was happening?
Yeah, it was just that last week I just went down for some reason. So
Hmm.
everything's fine now. I think
Well,
maybe I
that's
was consuming too much, you
so
know?
yeah, we're going to get to that because what happens is that you can consume too much water or fluids and you tank your electrolytes. So we're going to get to that. So that could have been without labs, without looking at your labs, I wouldn't be able to tell exactly, but that is something that could have happened. And so we're going to talk about that in a minute.
Yeah, that was it. It was the electrolytes. It was potassium and I think magnesium or something. Yeah.
Mhm.
So yeah, I, to my recollection, it was that. That had a lot to do with it. And the Charlie horses, they were kicking in.
Oh, yeah, you were low on your magnesium and your potassium,
Right.
for sure.
Yep.
For sure. And in spite
Thank
of
you.
drinking water. So that's why I say, like, use this as a guide, the body weight, all of those are important because, again, those are guides, but the most important thing is to listen to your body. Because here we have Valerie was drinking and still felt sluggish and was having Charlie horses. And so that was a key sign that in spite of all the water she was drinking, she wasn't properly hydrated. So, how do you know you are hydrated? Some people go by the urine, pale yellow urine, but that's not totally it because if you drink enough water or drink enough fluids, your urine is going to be pale yellow, right? Um, but by overall pale yellow urine, having a good normal energy, your lips, your mucous membranes inside your mouth, your lips, your skin. You can do this pinch test. If you pull your skin, it should come right back. You know what your skin looks like when it's dry. Um, Dizziness, headache, fatigue, brain fog, those are all sure signs that you're dehydrated. Another good sign, and you won't know this unless you have a blood pressure cuff at home, which I encourage us all as minorities to have blood pressure cuffs at home because it is the silent killer. If it runs in your family, no matter how well you feel like you're taking care of yourself, it is important to stay on top of your blood pressure. So I want to get that out there. But when your blood pressure is high, again, it's that sticky blood. It can't get through. It can't, the heart is having to work so hard to get the blood to circulate through. So that is a good sign of dehydration, is a high blood pressure or a really low blood pressure. Because again, it's just not able to get through. So if your blood pressure is super low and you're not normally low, and that's why it's good to know what your baseline is, or if it's extremely high or just over more high than normal, you could be dehydrated. Numbness, tingling feelings in your hand and your feet. Again, think about circulation. A lot of people will have that and think, oh my God, there's something like mad wrong. Could be, but we like to start with the simple things first. And I always tell my clients and my patients, let's start drinking some water and see if that numbness and tingling goes away. And for about probably 80% of my clients and patients, it does. The other sign that I don't think I put down here is a rapid heart rate. Like some people think they're having a panic attack, it's going so high, or you can feel it in your neck. That is also a sign of dehydration. So just to let you know, or a sign of dehydration, right? But how do you know that you're hydrated is when you don't have all those things going on. Does that make sense? Everybody with me?
Absolutely. I actually suffer from that. I can relate to this one very well. My heart rate is in my throat. I can feel it's about to pound out of my chest. and I know it's because I'm severely dehydrated.
Okay.
With
Good.
any physical activity, that's my first sign that I
That
have
you're dehydrated.
exactly.
And then by the time you're that dehydrated, you're really dehydrated. Like you probably need an IV. You need to come see me. By that point, when you're that dehydrated that your heart, so we'll get there because you can't drink enough water to cure that level of dehydration that fast. So let's
Right.
get there. Let's go there. We'll get there. Let's talk about the different times to drink and how to drink. Um, Hydrate consistently throughout the day. So when I talked about a little bit about chugging large amount, like you're like, oh my God, okay, now I know I'm dehydrated. I think it was Saturday. I was doing a lot. And I was drinking, but obviously not enough. My mouth felt like cotton. And I was so like, okay, you way beyond dehydration because now by the time your mouth gets dry, you're super dehydrated. By the time your heart is racing, you're dehydrated. If your blood pressure is consistently high, that means you're consistently dehydrated and you're damaging your heart because that heart muscle was not meant to beat and to have to work that hard. So when we have high blood pressure, and a lot of people will be prescribed medications, but what I always try to tell my patients is let's try hydrating for a couple of weeks first and see if we can get your blood pressure to come down. And then if not, then I'll put you on medication. But at the same time, these things work in concert together. Because we have people out here on hypertension medication when really they just may need to drink water. Does that make sense? Yes.
Yeah, and I share this in the community. My family is hypertensive. I'm hypertensive, but literally since I've been sort of locked in on, this hydration piece, I think there's a combination of different things. It's the stress of checking your blood pressure. There's some anxiety around that. It's like you said, a cascade effect. And so one, I have that blood pressure cuff that I encourage everybody to get and have in your home. I agree. I just said that. But then just consistently checking my blood pressure every day
Makes your
helps
blood
me to
pressure up.
collect data. So I want y'all to hear this. When you're consistently checking your blood pressure every day, or even if it's blood sugar or whatever it is, you're collecting data, all right? And from that data, you're learning what your triggers are. You're learning what's going on in your body. When people are just going to the doctor and getting their blood pressure checked once a year, they don't have any data on what's going on in their body as it relates to that. But if you're taking your blood pressure around the same time every day, when you get a spike, you can then say, did I hydrate? Did I get enough rest? Am I nervous about something or am I anxious about something? You're now able to make more informed lifestyle shifts because you have that information, right? And so the testimony that I want to share is that, y'all, my blood pressure, I went to the doctor yesterday. I shared it with the ladies yesterday. I went to get my well woman visit. And I always tell the nurse when she takes my blood pressure, when you come in there and they take your blood pressure, take your pulse, they check your weight. I'm always like, it may be a little high because I have white coat syndrome. I tell her all the things. Y'all, yesterday it was 124 over 80,
Ooh,
my blood
all
pressure.
right. All right.
And I was like, and I sent it to my accountability partner, and I was like, I haven't seen that number in in a minute. It's always like 150 over something, but it's literally, and my doctor told me, she said, if you consistently hydrate, you're gonna start seeing that your blood pressure drops. It's gonna just start going down naturally.
Yeah.
And so she is right. Ari is right. We are out here on this medication, and really a lot of the things that we're dealing with is lifestyle, y'all. Lifestyle is the true medication. That's the medicine. So we got to lean into this lifestyle stuff. You hear me? All right, let me stop there. But 124 over 80 booze.
Yes.
Completed. Let's go.
That is good for celebration. Yes. I plug in my computer's about to die. All right. Thank you for sharing that with us. because that is a great testimony because I see that over and over again, even in my own life. So during COVID up through 2021, until I really started this business and got into it, my blood pressure was high. And I said, oh, it's stress, it's COVID. Oh, it's stress, it's my kids. Oh, it's stress, it's the job. It's hereditary. My mama had it, my daddy had it. So, and when I really started dissecting hydration, I mean, I always knew what it meant, but like when I really like applied it to myself and I saw my blood pressure go down, I was like, wow, this is what it is. So thank you so much for sharing that. That's true. That's true. So how and when to drink? I think I heard some of you struggling on like, it's hard to figure out what to drink. And I got my big gallon and it's still chugging in a large amount. And you'll see this sometimes with runners. You'll see this with people. They just like, my son used to do it. He ran track. And I was like, baby, don't drink that much. You're not even going to get to use it all. You're going to pee it all out before you can even, use it. You're going to get a stitch, right? Because when you put that much, your stomach can hold about 72 ounces. So what's the big deal, right? But not all at one time. And so the muscles in the stomach start to contract. The diaphragm starts to act weird. It's like, oh my God, what are we going to do with all this? And you get a stitch, either throw up or you sit there and you're so uncomfortable for like a good hour until it digests. So it's like, it's not even worth it. It's really to drink throughout the day. This is just a suggestion. Some of my older clients, I say 1 glass in the morning, one in midday. That's really not enough. I really think you should be drinking once every hour. Let me just show you did I put that on the next slide? This is my favorite kind of bottle right here. I used to write on my gallon before I found them. I used to write on here the times just to keep myself honest, right? I think these are great. Several stores sell them. I'm going to start selling them. I think that's a great guide. In that hour, you have an hour to take sips and not try to chug a whole 8 ounces to make yourself uncomfortable. I think this is a good way to do it. When you're exercising, again, because when you're exercising and blood is going to all those different organs and body parts and muscles, if you drink a lot of water in between that, again, you're going to get some cramping. So take sips throughout every 15 to 20 minutes. And then when you're done, you can go back to that hour of sipping. Does that make sense? Cool. All right. Any questions here? Yeah, this was big. I was a track mom. And he was like, Mom, please stop telling people not to drink too much. And I was like, well, I'm sitting here watching y'all throw up on the sidelines, like, because you're running these 400s, you're running these races, and then you're sick because too fast is what I think, was it Lori or was it Valerie that was sick, right? Because you weren't feeling yourself because you were diluting the amount of water in your body. So drinking too much, you get hyponatremia, which is low sodium, which makes you dizzy. Too much sodium makes you dizzy and too less sodium makes you dizzy. So again, trying to find that happy balance in between. Not enough magnesium, you won't be able to sleep at night. Not enough magnesium will also make your muscles cramp, along with not enough potassium will make you cramp. So your body will start to feel it. And so you're like, man, I just drank all this water. Why don't I feel great? Why do I feel sick? Why do I feel like I want to throw up? Why are my muscles cramping? Because again, what is hydration? All the way back to the beginning, it is the balance of water and electrolytes and finding that balance. So how do you avoid that balance? By just taking some of these like little hints. Don't drink too fast. Drink throughout the day. And sometimes you can even add a little salt. If you are sweating and I don't suggest if you have high blood pressure to add salt. I don't suggest if you are not sweating, if it's not a hot day, because that's what your fluid electrolytes, like your Gatorades and that, has a little sodium in it to replace it so that when you are sweating, when you are working out, that you don't deplete all of your sodium. So the only time I really suggest is that you add a little pinch of salt, and I'm saying a pinch, like my grandmother say, add a little pinch, just a pinch to your water if you need it. if you if you can't get to the store and get Gatorade and you know you've been drinking water and you feel out of sorts, just add a little sodium to your water and see how you feel after that. But I don't suggest you do that if you have high blood pressure or if you're not like profusely sweating or if you haven't lost a lot of fluid. So think about when you get sick, what do they say? Drink, have some soup, right? Replace those fluids or replace those electrolytes. You can think about that in the same way. You with me? Okay. So what to drink versus what not to drink is my favorite. See, that what to drink is on the short list. But you could do a lot with this. I mean, water, granted, right? Coconut water has the highest osmolarity, meaning the level of electrolytes and fluids that is as close to the body as possible. So I'm not a fan of the sports drinks, but if that works for you, drink those. But I say coconut water. I say water, coconut water, and you can also do fruit infused water if you don't like the taste of it. So I don't have a picture of it. But you've seen those bottles and they have like a thing you can put in the middle and you can put your fruit in there. Just enough. My favorite is mint. I love the taste of mint and cucumber together. Just a little hint, just a little bit. I love watermelon. I love watermelon water juice anyway, but if I just take some and put that in there to diffuse it, it's just enough. Where if I'm just bored with water, or sometimes it just sits right here. It's just one of them days where I just cannot drink a whole bunch of water. I need a little something in it, not sugar, right? So these are my 3 recommendations for your water. Skip all the other. Any coffee drinkers here? I love my coffee, but I can't drink it like that. It is dehydrating, actually. It actually robs you of water. Same thing with alcohol. It actually pulls water out of the cells. Wish I had a demonstration of it, but it actually is pulling the water out of the cells. It's like, hey, come go with me. I'm caffeine. Come go with me. I'm alcohol. Come on, come with me. Don't stay here with her. Come with me. And so we feel worse when we have those 2 beverages. And energy drinks. Again, the energy drinks, and I used to drink them. I did actually there was a bank, PNC Bank, when I first got started with this business. They were doing a weight loss challenge or just a healthy challenge. So when I went into the bank to kind of interview, see who my new clients are going to be, more than half of the bank was on energy shots. Like they would just bring them all in. You go into the break room and it'd just be like a basket. You have a basket of crackers and had a basket of energy shots. I was like, what are y'all doing? And they were like, it's just, that's what keeps us going. And so I was giving them B12 shots, some once a week and some twice a week, to give them more energy, to get them off the energy drinks because they were having palpitations. And again, how confusing that can be. Am I having a palpitation because I'm dehydrated? Am I having a palpitation because I'm on an energy drink, or do I have heart problems? So you see how it kind of convolutes things. But I would say definitely not to do the energy drinks, because again, that is also a fluid stealer. It's going to pull good fluids out of the cells. But the other thing that you can do to combat that if you're low in energy is look at what your B12 and your B complex is, because those are your energy vitamins. And you'll feel much better and be much healthier with the B12 and a B complex. You do a shot in the arm, or you can take it, if you have some that you take by mouth, you can do that as well. But that's going to be better than your energy drinks. So it takes time though. It takes, especially if you're a coffee drinker, like a card carrying coffee drinker.
So Ari, could you talk a little bit about B12 complex, B12, B complex and B12 in IVs?
Yes. Let me get there.
Okay.
So let me real quick, let me go through that because I'm getting to the IV hydration. I'm looking at the time too. We're getting close. All right. So IV hydration, well, hydration in the brain, staying hydrated is crucial. I like these slides because, again, sometimes when I'm teaching a class or I'm talking to clients and they're like, yeah, water. But when I break it down to how important it is for each body system, it's a real level, a high level for your optimal brain function. Think about having to put oil and gasoline in your car, how you need both of those to hit sparks to make it work. Same thing with your brain. If you don't have hydration and you feel like brain fog or you feel sluggish, that's why. Another crucial component for hydration is your joints. If you like me and my family, arthritis runs in my family, so I'm already trying to combat that. But staying hydrated will avoid that bone on bone because there's what's called synovial fluid that's in the middle of that. So if you're dehydrated, you're going to break down that much sooner. So you definitely want to stay hydrated for your joints and for your heart. And I think we talked enough about the heart already. So definitely want to stay hydrated for your heart. Get that blood pumping through. All right. And for weight loss, it helps control your appetite, helps boost your metabolism, and helps you excrete it quicker, bowel and bladder. All right. My favorite part, IV hydration. So has anyone ever had an IV other than when you were sick and you had to go to the hospital and get rehydrated or you had to get medicine? Has anyone had IV hydration just for IV, just for hydration? You have. Okay, great. How was that experience for you?
It was beautiful. Good energy. And it wasn't just hydration for hydration's sake. It was also to optimize for immune support.
Good.
Um, against COVID and viruses. And so it was recommended by my doctor to do IVs monthly. And then when she saw that my immune system was really strong, like every other month, for example.
Yeah.
So yes.
So everybody is different, right? And we, keep reiterating that. But IV hydration, you can get, I have some clients that come weekly, some that come every other week, some that come monthly, some that come quarterly. So when I mentioned about the B12 and B complex, I also give magnesium via IV hydration. Immunity, like something called glutathione, which is a powerful, one of the most powerful antioxidants. It's like a scavenger. It goes through and it gets all the toxins in your blood. It also is good for your skin. Vitamin C. During COVID, that was the one thing that kept me busy, was giving the high dose vitamin C. Your body is going to excrete it, but when it goes in, it's going to take what it needs to fight whatever it has to fight, and then you will excrete it out. So all of the vitamins, the B12, the B complex, the vitamin C, the antioxidants, the minerals, can all be given to you via IV. And what happens is that when that catheter is in your arm, you get direct bioavailability. That means that as soon as I give it, as soon as you get an IV, you're going to start feeling it's going to start working right away. Versus if you take a pill, and I'm not saying don't take vitamins by mouth, so you can't get an IV every day. But if you take a pill by mouth, it has to go through the stomach. And once that breaks down, you get 50% or less of what you think you're taking. So you may feel better over time, but your body, once it breaks it down, those vitamins, you're getting 50%. So you're not even getting that recommended daily allowance that's on the bottle. With IV hydration and IV vitamin therapy, you're getting 100% bioavailability. Is going directly through your bloodstream and going exactly where it needs to go, doing what it needs to do. And when it's done, those water-soluble vitamins like the B's and the C's, then you will pee it out. So there's no toxicity, there's no toxic level going to be sitting in your blood. Once it does what it has to do, it comes right on out. So understanding IV hydration, again, it's basically, a lot of people are afraid of it because they're like, well, why? I don't want a needle in my arm. I understand that. I can also administer a shot, but you don't get the fluid. You don't get the fluid volume. You don't get the IV hydration to hydrate your cells and pump them up the way that they need to be to carry the nutrients throughout your body if you just get a shot. But I'm not knocking that. You can get a shot and it will do what the vitamin is supposed to do. But when you mix the vitamin with a bag of fluids, right, then you're getting that full nutrient boost. You're getting the fluids that you need in addition to the nutrients that you need. Does that make sense? Yeah. So I recommend, if you haven't tried it at least once, try it. Then try it with me. I have, for people who have hard veins, I'm really good. I've been doing this a long time. I can find a vein. I have numbing spray. And here, I don't want it to look like a doctor's office, because so many of my clients have to go to the doctor on a regular basis. When they come here, I want them to feel like it's someplace totally different. So maybe I'll jump on my phone and give you a tour, or maybe you'll just come and see me if you're local. But I like to make it a pleasant, fun experience. I play fun music here, and just so that you can relax. But IV hydration, I have found just in my own life, personally, weekly, it keeps me hydrated. It will last. I mean, once you get 1,000 liters, right, which is a full IV bag, you're going to excrete that out. You're going to urinate that out within 24 hours. And then you have to keep drinking, right? So don't think that, oh, I'm going to get an IV bag and I don't have to drink for a week. No, the next day you have to keep drinking. You're going to have to replace what you urinate out. But it does put you possibly ahead of where you would be if you were just drinking. Because again, we all struggle. Most of us struggle with trying to stay hydrated by mouth. So that's where IV hydration can be helpful. It can also be helpful if you are not feeling well, if you're sick, if you're dehydrated. Like, I think someone was saying that you're so dehydrated, you can't drink that fast. Again, you're going to go through where you will deplete the minerals that you need. So to have it infusing at a certain rate, that also is going to help you not be overhydrated, if that makes sense.
Ari, I want you to talk about the different kinds of IV bags that you do, and we'll go through them.
Yeah.
What, like,
So,
if you're this kind of person, you should probably get this kind of IV. If you're that
gotcha.
kind of person, etc.
Okay. So if you're low on energy, you're fatigued a lot, you should get our energy boost, which is B12 and B complex. Your B vitamins, and if you're a vegetarian as well. I'll tell you why, because B12 is usually found in meat. And so if you're not eating a lot of meat, how are you getting your B12? You can get and I know I'm switching lanes here, talking a little bit more about nutrition, but it's all together. You can get your protein through beans and rice, or beans and corn, right? There are other ways to get and I'm in your kitchen now, Natasha. However, most vegetarians are low in B12 and low in B complex. So this is a good one for you. If you are sick a lot or you're traveling a lot, I have a immunity defense, which is zinc, vitamin C, and glutathione. They're great immunity boosters. So we take them every time before we travel. We take them when we come back. We give them to the kids before they start. I can give it in an injection or in an infusion. It's really very helpful. I can't tell you last time I've been sick. So it's very helpful. Some of the other ones are magnesium drips. Magnesium drips are good for stress, migraine headaches, muscle cramping, menstrual cycles, because again, it works on the muscle. So if you're having cramps, headaches, stress, I used to give it to my son all the time in his last few years in college. Chills you right out and helps you sleep at night. So it's very helpful. I do a high dose vitamin C drip, which is really good for immunity. It's just the vitamin C by itself. It was my protocol that I used, and I worked this out with the area doctors. This is actually what they were using in the hospital for those who were willing to take it. The vitamin C is very helpful to help recalibrate your immune system and fight off whatever you're trying to fight off. Those are my top sellers. I can make an IV for whatever. Like, once I do a consult with you and you tell me what's going on, then I can customize an IV just for you. But those are my top sellers.
What about the Myers cocktail? Any of those that you've talked about have the Myers?
So Dr. Myers created the Myers cocktail some years ago. And this was years ago. I want to say like in the 1930s or 40s. to combat chronic fatigue syndrome. And so what I have described to you is a combination. I do offer the Myers. The Myers is basically a magnesium, vitamin B, and it can be some other different minerals, and everybody has a different kind of spin that they put on it. My Myers is heavy in magnesium and vitamin B because those were the main ingredients that Dr. Myers used to help combat chronic fatigue. But you can also throw in some other ones. But yes, the Myers is great. The Myers is great. I also do a hangover IV, which is also good. That one is full of vitamin B, right? Glutathione, because glutathione detoxes your liver. So there's no way you're going to get all that alcohol out of your liver in 24 hours. So the glutathione helps with that, and the B vitamins. And then sometimes I also do give medications as needed if you want that. Toradol, which is good for a headache. Because what is that? What is a hangover? Does anybody know what it is? What it really is? Take a guess. It's not sexy. It's your brain is swelling.
Okay.
Yeah.
I thought it was dehydration, but it could be the same thing, really.
It is. So when your brain is swelling, it is dehydration. Yes, it is. But that is the catalyst, because there's swelling, inflammation in the brain because you're dehydrated. Yeah. So
I didn't know
that's
that.
what yeah. So that's the basics of IV hydration. Any questions there? I'm sure you have some questions. No?
So let me ask
I
this.
do have a question. Oh,
Okay.
sorry.
No, go ahead. Go ask your
I
question.
have a question. So my question is, so I I was vegan for a while, and then when I was able to get closer to farmers markets and stuff, I had to go to the doctor because I was getting a lot of like iron infusions, but not the IV iron infusions, like the ferrous infusions, because
sulfate?
um my stomach wasn't absorbing iron like just through iron pills. I was having a problem with absorption. So they started doing all these tests and trying to figure out like, was there something bigger going on? Was the blood being going to something else like a tumor or anything like that? But I was having a lot of problem. I honestly feel like it was brought on because of stress, because when I started to meditate, everything went back. Like years later, when I started meditating, everything started to reset. But I still do struggle with like iron deficiency. And I wanted to ask you about vitamins that have like digestive enzymes. I've been able to take those and they have been able like to process better. I just don't know, like, is that a long-term, is that a bad effect to have vitamins with digestive enzymes, or is that okay to have those types of vitamins with digestive enzymes in them?
So let me make sure I understand. You were having a digestive problem. You were having problems digesting food.
More of that. I wasn't absorbing iron. Like even if I just took like iron supplements, the iron wasn't absorbing. And then when I became vegan, it really is a real vitamin deficiency. I wasn't supplementing. I was just strictly just eating, trying to get all my vitamins through food. And so I've since like started eating like, like liver and that kind of stuff. And it's been a lot better for me.
Okay.
But I just wanted to know, like, sometimes like when I feel really more like I feel depleted, I've taken like a B complex with digestive enzymes. And I wanted to know if that are digestive enzymes okay to have in vitamins, or is that like something that is not good for your body, or just curious.
So my take on digestive enzymes, right? So like papain, which comes from papaya, to help break down food. I get concerned when they are mixed with vitamins because of the lining of the stomach, right?
Right.
So if you are breaking down, they already have this protective coating over it, and you're breaking it down even more, I feel like it's bypassing that protective coating, and it can hurt your stomach more. So I would avoid that, especially knowing what I just said, is that no matter what you do, you're only going to get 50% because of the breakdown of the acid that happens in the stomach.
Mm-hmm.
I hate to hear, then if you got the digestive enzyme on top of that, you might be getting less.
Right. Well, I
Mm-hmm.
appreciate that. Thank you.
Yeah, you're welcome. You're welcome.
I'd like
One
to
second, I'm
add
just
to
gonna
that.
close my blinds real quick. Just
Yeah.
give me 1 minute.
Miko, I wanted to respond to what you asked. So one of the things, so instead of looking at the supplements per se, really want to think about getting your digestive enzymes from food, live food. And so some live foods that will help you with that would be like microgreens, sprouts, things like that. So many of us are just dealing with this in terms of getting the full nutrients of our food. Many of us are dealing with that issue, i.e., we're not getting the full nutrients from our food. However, when you use live food, let's say you add some microgreens or some krauts, things like that to
Mhm.
your plate, then what will happen is it will help you to it will help with that absorption piece. All right. The other thing that I would say too is, and we did this isn't a course, one of our chiropractors talked about the importance of being adjusted and the importance of being adjusted because it actually helps your body to receive nutrients more balanced in a more balanced way. And when you're not adjusted, then it kind of can throw things off in regards to how you receive nutrients. So I would definitely,
Well, I just say that's very interesting that you're saying all this because I had an accident before I moved from when I left LA. I had an accident in LA. And right now I'm seeing a chiropractor and a PT and all this kind of stuff. So I'm actually getting adjusted. And we add fermented foods to our like pickled vegetables and kimchi and sauerkrauts and stuff to our foods. And we have microgreens as well. So I really appreciate all that affirmation here. That it feels very affirming what you're saying. Thank you.
yes, you're welcome.
That's good. All right. Let's see. So we talked about are there any other hydration myths that you would like to ask me about? Anything?
So I want to ask one. Okay.
Mhm.
So there's a brother, I actually went and I studied with him in Panama. Beautiful brother. He's an elder. He's in his 70s, from Panama. His name is Aris Latham. And Aris does not drink water at all. He
No,
drinks
I know that
he
guy.
drinks coconut water. Yes.
Yes, I only drink
His
coconut.
primary water is coconut water. And one of the reasons why he left the United States and moved to the Caribbean, he moved to Jamaica first. He was there for many years and then decided to go back to his home country, which is Panama. He said, I don't want to live in a country that doesn't have coconuts because I need to get fresh coconut water every day. So that's his. So is there a myth, and is it contingent on where you live, right? About water. Can you drink water, or are there other sources of clean water, i.e. coconut water, right? Or living waters from watermelon and cucumbers and celery that you can use daily that will hydrate you efficiently and properly like plain water. So that's my
You
question.
can. It's so hard in the United States economically to do that. It may be easier for him in Jamaica. Um, gosh, I'm trying to think how long ago this was, but I remember hearing a story from a war veteran. They needed to start an IV and they were out in, you know, desert land, wherever they were, and they had to spike an IV. They had to get the water from a coconut. I would not do that unless I had to because the sterility and all those things, but they were in the jungle and this is what they had to do. So yes, right? And I'm careful about who I tell that story to because I know a lot of people who will try it. But yes. So no, I don't disagree with the brother for moving and you can um just again, your body where you are is hotter there, right? He's in Jamaica. I can't hear you.
He's in Panama. So he
Oh, he's
was
in
in
Panama. I'm sorry, he's in
Jamaica,
Panama.
but
Yeah.
he's in Panama. And I will say, because we asked him, like, brother, you almost 80, right? He's
Mhm.
very, very, very vital. He's very
Mhm.
vital. Can
Mhm.
bend, can jump, can climb coconut trees. And every elder in Panama, once you pass 70, they have to get a well man or well woman visit
Okay.
in order to keep like their benefits and stuff like that.
Okay.
He said there was no problems with him when he went to the doctor. I was with him a couple years ago, studying with him.
Yeah.
Said so this thing around water is, I think it, like you said, it depends on where you live. Like if you're in a place where you have coconuts that's abundant, we
Hmm.
don't have that. You don't have access to that kind of life here in the
Right.
States.
No, we don't.
And,
You saw the second on my list was coconut water.
yes, it was. It sure
Mhm.
was.
And we drink a lot of it. My son, he prefers coconut water over water, and I'm not even gonna fight with him about it because you're right. Yeah. Yeah. It's expensive though to do that. So, right, if you go to Publix right now, if you go to Kroger right now, which one is gonna be less? You see how high the price is for coconut water? It's like
And
$4 and
$5.
something.
Hmm.
And a lot of that has to do with industry, and that's a whole nother webinar. So, yeah. But if you can drink coconut water, yeah. Like I said, it has the closest osmolarity. That means all of the chemical properties closest to our blood than any other compound that you can find that you can buy. Yeah.
And I asked a quick question about coconut water. I like coconut water, but I can't drink it. It immediately makes me go, not trying to gross anybody out, but makes me go to the restroom. But I
Yeah.
like it.
Mhm.
Yeah.
Yeah. And that could be, again, the electrolytes that are in it affects you. You're a little bit more sensitive to it. It's not a bad thing to go as long as it's not diarrhea. And that's the other thing. That's another myth that not specifically tied to dehydration, but we should be actually eliminating after every meal. But again, our diets here don't allow us to do that. We really have to train our bowels, our system to do that. So maybe, Jody, you can drink coconut water in moderation, or does it really upset your stomach?
No, it doesn't upset my stomach. It just makes it, I just have to go. So
Mm.
if I do drink it, I don't drink it out. I usually drink it at home.
Yeah, but yeah, it's a good thing.
That's
Yeah.
actually a good thing, Jody P.
Yeah, as long as
Yeah.
there's no, again, and so I'm sorry, the nurse in me is coming out. As long as there's no blood in your stool, you're good. So yeah,
Yeah.
okay.
Okay.
Any other questions? I've enjoyed my time with you all. This has been good. I hope you've enjoyed it.
So I want to remind you guys that, for the challenge, the folks who are here with us for the 21 days, we announce what the three challenge prizes are for the first place winner, second place winner, and third place winner. And for Ari Johnson, if you decide that if you actually win third place prize, you get a 20% discount on an IV at Spa Citrine, along with a hydration bundle that I will provide. So it's like a little power hydration bundle that I'll provide. So, y'all, if you're here in Atlanta, get on down to Spa Citrine. And I would even say, because we do have some people who are, California, people who are in Maryland. Miko, I was about to say New York, but you're not in New York anymore. You're in North Carolina, right? Miko? Is it North Carolina? Well, if she comes on and tells me, Miko, I think moved to North.
Yeah, I'm on North Carolina. Sorry, I don't know how to do this on my phone. I'm sorry
It's fine.
to unmute myself.
But
Yeah, I'm in North Carolina.
that's a reason to come to Atlanta, and come and hang out at the spa and get your IV and get some health and wellness, some healing and all of that. Second place prize is a virtual cooking class with me. And the first place prize is a consultation with Dr. Nicole Peoples. So we got 5 days left, y'all. We got 5 days left to the hydration challenge. So you got some really nice prizes, I think, for the folks who are locking in and doing the work, you know? Does anyone have any question? I always ask these things just to make sure that everyone's with us. Desiree, what you want to say to us? And I'll ask my question afterwards.
Yeah, I was just going to ask, did we touch on pH balance?
We did not touch on pH balance.
Okay, and the reason why I asked, my question is kind of twofold. So in our last session, I told the community about this hydration test that I ordered off of Amazon.
Mm-hmm.
Have you used any of those? Do you have any preferences?
No, I don't have a preference. I know that, when we have a pH balance above 8, 9, this is a alkaline space where it's harder for disease to grow. It's harder for disease to be processed there. There is scientific study about that. The medical community is slow to come over and promote that again for numerous reasons. But I have not looked at any specific tests. Like, do you have a water system at home that you're testing?
No, and I don't have it in my hands, but I ordered this. It's a p-test. It's a
Oh, for you.
yeah.
Okay.
So one of the things that the test, because I finally took it, and one of the things that the test came back and said was my hydration level was actually a 10 out of 10, but my urine was acidic and my pH was a 7. So I was going to ask if you had any recommendations on how to control your pH balance. I know one of the ways would be maybe drinking,
Mhm.
like smart waters, pH balanced.
pH balanced water and some of your foods. And I don't know the pH balance of all of the different foods, but you can also do it naturally by looking like the pH of cucumbers versus the pH of watermelon versus the pH of celery and those type of foods that are hydrating foods as well.
Gotcha. Okay.
I'll add to that. So, lemon juice, lemon and limes are acidic, but they're alkaline forming in the body. So you might want to add that to your water. That'll help to boost your alkalinity, because it's a cleanser. It just does a lot of good things. Um, as you said earlier, the watermelons, the living waters, the celeries, the watermelon juices, cucumber juices, that's what I was thinking. Just all of those like really nice, gentle living waters, bringing more of those into your diet, watching your sugar. So really think about, what kind of sugar sources you're using. If you're using any of those, like we talked about electrolytes, and we have a really good quality electrolyte packet that we use, the one from Thorne. But be careful not to use a lot of the electrolyte packages that have a lot of sugar in it, because then you'll have that added acidity to the urine. So just be mindful about that, not eating a lot of sugary things late at night, a lot of bread late at night, because those things turn to that can,
Alcohol.
yeah, absolutely. Not drinking a bunch of alcohol. All of those things will impact your acidity level. I hope that helps, Desiree.
Absolutely. Thank you.
You're welcome. All right, so what I want to do is, because I know we're running short on time, I want to go one by one and just ask very quickly, what's one thing that you learned tonight that is a big takeaway for you this evening? I'm going to start with Dr. Lauren Bridges. What's your biggest takeaway tonight from our conversation?
Well, the debunking of the uh half your body weight in water, that was a big one for me. Because I've like it's been gospel for me for quite some time. So that was interesting. And then also, oh my gosh. Let me just stop there. Yeah, that one was the biggest one. I don't want to extend any longer. But yeah, that was a big one for me.
All right, Tiffany, how about you? Can you hear us, Tiffany?
Yeah, I was trying to unmute. I would definitely say the same thing that Lauren said as well. But just also just it made me feel proud though too that I'm on the right track because I've been doing IVs for probably almost 5 years now, I think. So it just really made me feel happy that some of the things that I've started that I need to continue. And then also how important it is to also even with family members like my mom. I was telling my mom about a month ago about getting IVs, and now I'm really after tonight. I'm like, really, you going? You're going, ma. But I also, even as I was listening, it just especially around even I think it was a slide after the one around the myths around like drinking half your body weight in water. The one where it tells you you're dehydrated if your skin is this or things like that. Like I have a lot of like I have a niece who just went through a major surgery, brain surgery, something she had going on, a tumor, but she doesn't drink water. And I want to thank you also, Chef V, because I was going out on Friday evening and I was on the phone with her and I was sharing the knowledge that I've gained from you and just the last presentation. And even like tonight, I'm going to go back again and I'm going to recommend that my sister take her to get an IV as well because she does not drink water and she's about 30. And I said, where is she going to be a year from now, 5 years from now, 10 years if she keeps this up? And so just being able to acquire more knowledge that allows me to also to help my family. So thank you all.
I share Tiffany.
Yeah, that's good.
All right, Lori, what's your biggest takeaway from our conversation tonight?
Well, the sticky blood kind of came to me because I really saw my blood. Like when they were trying to take my, I was doing a blood, drawing normal blood, and it literally was just dripping out. I was like, I've never seen that before. And the woman was like, well, you don't drink enough, but nobody said how bad it was, and I didn't think they asked my doctor. So now it makes sense why. Um, and through all the water, I think brain fog is the one that's I noticed biggest for me. My brain fog is not anywhere near as bad as it was. So I am thankful for the water for that. So I'm not drinking water.
Hey, Lori, good job. Valerie Peak, what's your biggest takeaway from our conversation tonight?
Okay, can y'all hear me?
Yep.
Hello? Oh, okay.
Mhm.
A lot. I mean, this was a great call. And like I said, I know where I've made a mistake being a chugger to slow down and take sips. And uh I really value you're saying that electrolytes are really important to correct things. And the new measurement for water intake. I'm looking forward to that sheet to be able to calculate, what I can do more of or maybe cut back on. So
All right, how about you, Pierre?
This was very informative for me. A lot of things I start putting together. Though it was mentioned to me, by the doctors that, maybe hydration is something because right now I usually have these pains in my head, my neck going up to my head. And as I think more about hydration, I can't remember as growing up, we never had this problem with drinking of water. You drink water and you feel thirsty. Most times you're hungry, most times you're thirsty, but you're feeling hungry, you're going to eat food. So, and just because, you eat, you drink a little water, but not the amount of water that we're drinking now. So looking back at all the different things that I am concerned about in my health, I could see where it was the lack of water. And over the years, now, as you're slowing down with things, now everything turning up, you know what I mean? So I sure will visit Miss Irie, Dr. Irie. I sure will visit her and start getting things together because I already having the hydration down pack now with all the different things we should use with it, and it's working well for me so far. But I'm having the same thing when I drink the water, then it goes out very soon after. So That I have a little concern about why is that happening. And it comes out, pretty clear, not pale, very pale, very, very pale, any kind of yellow, very, very pale. So
Are you saying that when you drink, you urinate very quickly afterwards?
yes, it don't take too long, like maybe about 40 minutes or so after.
That's not a bad thing. So we digest fluids and food anywhere from 5 minutes, 10
Mhm.
minutes to 120 minutes.
Okay.
So that
Mhm.
can happen. It could be related to a lot of different things that are minor. So
Okay.
yeah, it's okay.
Yeah. Well, the color in the urine is pretty okay, but yeah, and I'm doing well with the water. I kind of get a rhythm for it. Even when I'm late, I could still finish in time before I go to bed, at least 2 hours before I go to bed. I can finish my whatever challenge I have to do with water. So what I do, I start to try early, and so if any hiccups during the day, I could still manage to finish the challenge,
Mhm.
Yeah. And same thing I'm doing with my walking and the eating. Well, I finish eat early since by 7 o'clock. I stop waiting and eat with my husband. I say, I'm not waiting for you. I got to eat early. I can't worry
Yep.
this late night eating. It's too much stuff going on.
Yep.
Yeah. So far it's very good. Very, very, it's pulling a lot of things together for me. This conference really pull a lot of things together for me.
All right. Desiree Foy, what's your biggest takeaway from our conversation tonight?
Oh man, the biggest one is actually a scary one for me because I have two parents diagnosed with dementia. And when you started talking about brain health, I was like, oh my God, I am the worst. I'm not I'm doing myself an injustice. I mean, I have gotten so much better. This is my second round with the hydration challenge. So it is a lifestyle change and I'm getting better. But at the same time, seeing it on your slide, I was like, oh my God, what amount of damage have I already done, before I made this lifestyle change? But anyway, it is what it is. We're here now.
And it's not too late. It's not too late.
So just thinking about that was
Yeah.
really, I got kind of sad. But the other thing too is the no chugging water because in the challenge, you know, I'm approaching my deadline. I'm about to go to bed and I'm like, dang it, I still have 15 ounces to go. And I start chugging anything to drag myself over that finish line. So now, Tasha, I cannot chug anymore.
Nobody told you to choke.
I already said no chugging, so I'm sorry. I don't make it, I don't make it.
Listen, nobody told you to chug. That's you. That's your guilt.
And then the other thing would be, thank you for reconfirming IV treatments because like Tiffany, I've been doing it off and on. Um, when I'm consistent, I'm going once a month. And now I have a new IV treatment home. All things are
Yay.
possible. Yeah.
Yes,
Yeah.
yes. I'd love to have you. I have a
Wonderful.
sauna. We have massage chairs. So yeah,
I'm coming to do all the things.
okay.
Ari, I'm coming to my look. I'm coming tonight. Girl, get a pillow for me. Comforter. I'm spending the night.
Oh my God. Yeah, so this was great. Thanks for being here tonight.
Well, good. Thank you. Thank you for having me.
Miko.
Hi. So, I feel like I came in late, so I don't know if I missed the water intake chart that everyone is talking about as far as how much water to take, and how many ounces to take in.
I'm gonna send it to you.
Okay.
Well, I'm gonna send it to Chef B and she'll send it to you. But
Okay.
it was this.
Oh, okay. I did see that. I did see that.
Mhm.
Um, outside of the fluid intake, I feel like firstly, when you talked about, I don't drink at all, because of my family's history with alcohol and so I don't drink or I don't do anything. Um, and I really try to limit my sweet tooth because sometimes I really have a sweet tooth. But um, I thought it was really interesting when you said about what a hangover is and how it, I too thought it was just about dehydration, just like feeling dehydrating, like the water just sucking all the fluid out of your body and you just feeling like really bad. But the fact that you said it was a swollen brain was really profound to me. And it's something that I'm going to take back and share with family members because I feel like same alcohol, sugar, all of this stuff, we see how it affects our families. um, they say dementia is sugar in the brain. They say cancer is, sugar in the blood, or diabetes is sugar in the blood, and cancers are, sugar in your organ in your cells. It just makes me think about how we process and how we process foods and what are the. I know it's really hard for people to be, you know, 100% clean. It's hard when people have these habits, but I just feel like this is such great information to share and encourage family members to just even do it like halfway. So I thought that was really, really profound. Um, the other part, I want to say like there was another part that was well, living in California, there's a lot of IV therapy. And I was kind of like, I don't know what these people's doing out here, because they do everything. Everything is happening out there. So I was like, I don't know if I trust going to these folks to do any of that stuff. But I definitely considered it. And I remember speaking to Chef B. Did we speak last year about a chef? I don't remember. But I think we talked about IV therapy and hydration and that kind of stuff. And I've never done it, but I'm gonna put this on my consideration list now because before I was like, I don't know, not because I I feel like what you shared, I feel like was very informative, but I feel like when I was in California, it felt like it was like another gimmick kind of thing. Because there's so many things that are happening out there where people are doing stuff outside of injecting all kinds of stuff in their face and injecting. So I was just like, I'm not on the injecting line, but um, I still have questions, but I'm happy to like open the conversation around that because I do feel like living in America with our soil, our fruits and vegetables don't grow the same in those tropical countries like the Caribbean. We don't get the same vitamins and minerals that we would normally get. Our lifestyles are very different. So I appreciate all the insight you shared about that. And I guess, we'll see. We'll see how the challenges turn out, Chef B.
And I would say, Miko, do your research. There are a lot of infusion places out there, and they're not all equal. And I hate that because it makes it hard for those of us who really do follow the standards. I have a physician that I order my products from, and they come from reputable grade A pharmaceuticals, medical grade pharmaceuticals. So like there's, someone like me that is making sure everything is done right above the line, better than what even the
Right.
standards is required. And then you have people, I've even had colleagues that I've had to like not really associate with because I'm like, where are you getting your vitamins from? You know what I mean? Like, do you really want that on your head,
Right.
on your heart, on your license? Like,
Right.
I don't understand it. But just do your research, look at the ratings, look at, what other people are saying about wherever you go, and it should be okay.
Well, I appreciate that.
Yeah.
Ari, thank you so much.
You're welcome. You're welcome.
So as we wrap up, this was so wonderful. I want to encourage you all to think about this. You are the experiment. Be your own experiment. All right. So all of the things that we're learning, some of the information is a step up It's a deviation from something that I might have said to you in the last challenge because we're learning and we're growing in this challenge. And what I will say is at the end of the day, we're providing the information and you also want to see how you're feeling. You want to also be tracking, okay, what was happening the first day of this challenge or what was happening before the challenge? How do I feel now? We're in week 2, day 16. Like be your own experiment, like see how you're feeling through all of this. See what's shifting for you. See what's improving for you. Valerie says something was off. She wasn't getting enough electrolytes. All right, now we need to add in electrolytes. So my blood pressure dropped. There are all these different things that's available for you. So be your own experiment and just really be critical with what's happening and how you make those adjustments so that you can get the full results from this. It's actually quite exciting when you can be your own experiment. When you can be the guinea pig, collect the data on yourself. Because ultimately that's the exciting part of a lifestyle change when you're seeing the small wins and the small successes of what you're doing. All right. So I want to say that to you. I also want to say to y'all, when we do these calls, it's never meant to make you afraid. Because I feel like after the last call last week, we were talking about hormones. Everyone was pissed off and they were mad about this and mad. This is meant to inform you of what's going on because hopefully we leave some kind of impact. That's why I asked you those questions. What's your biggest takeaway? Some nugget that you're gonna go down the rabbit hole and maybe, we do more research on something because that's when the shifts start occurring. When we get those aha moments, those light bulbs turn on. So none of what we're saying with any of these challenges, any of these presentations is meant to make you upset or nervous or scared. Oh my God, what have I, because I heard you, Desiree, what have I done in the past that I could have been doing? We can't go back there. Don't worry about that. You got the information now. What you gonna do with it? What shift are you willing to make now? What small change are you willing to make now? You can't go back. Don't worry about what you didn't do. All right. Focus on what you can do now with the time that you have. All right. So that's what I want to say. I love y'all all. And you have resources. You have Dr. Peoples, you have Ari Johnson, you have me, you know, onward and upward. And we have some other amazing folks in this community that can support you and serve you in your well-being. So do not look at the past. Just focus on where you are and what nugget did you get. And at the moment that you got it, wow, it's a blessing you got that information because you can use that information to change the life of a loved one. Hence what Tiffany said. Hence what you said, Desiree, about your parents. Maybe there's something that I can do now that I know this to support their well-being. All right, that's all we got is now. So as you say, Dr. Bridges, onwards and upwards. Absolutely. You know? The last person we didn't talk to was Jody P. I'm sorry. Jody P, what's your biggest takeaway?
Um,
Wrap
I
it up.
guess one of the things is about the sticky blood because hypertension, high blood pressure, as you know, runs in my family, and I'm I'm doing better with the water since we've been doing the challenge. But I've always been a drank water. But I'm really, after listening to Ari, just the importance of having, drinking water. And then what was eye opening is the brain fog because I just had an aunt that was diagnosed with dementia, and I have relatives that they drink wine all the time, alcohol, and makes me wonder now if that's a main reason why, because you don't drink water but you're drinking a lot of alcohol, sugar, things like that. And so those are the two big things. So I appreciate you, and I definitely want to give the IV a try. I've never tried that before. I've heard of it, but I've never tried it, and I definitely want to give that a try. So thank you.
You're welcome. Oh, it's my pleasure.
All right, so we're gonna wrap it up. Actually, Ari, if you can unshare your screen so we can get everybody
Sure.
back on the screen here.
Yeah, I think
So thank you all. Our next,
am I still sharing? Oh, here, I'm sorry.
you are.
Stop
Yep, there
sharing.
you
There we
go.
go. All right.
So our next call, guys, is on Friday night at 8 o'clock. We are wrapping up the hydration challenge in a few days. So please continue doing your work. You have these little mini daily challenges that I've been giving y'all. I hope that's been helpful for you to try something new, some little thing. We'll have a conversation about our kidneys on Friday night. Just a little mini conversation about kidney health in all of this, because actually, quite a few people, when I talk to them about the hydration challenge, they tell me that they're dealing with kidney issues. So we just want to also make sure that we talk a little bit about that as we kind of close out the segment.
So
Uh,
one thing I will say about IV hydration and kidney issues. So in order to receive IV hydration, your kidneys have to be able to clear it because you're getting a large volume of fluid at one time. So outside of a hospital setting where that kind of thing can really be monitored, in a retail setting, because that's what this is, we do not and we should not give IV fluids to anyone that has kidney failure or any type of kidney issues or liver issues because it would be hard to clear the vitamins and hard to clear the fluids. And so in the intake, and this, if you are looking for an IV hydration place to go, this can be one of your checks. How well do they screen you to make sure that you are a good candidate to receive the therapy? That's real important. Because the last thing you want to do is you have kidney problems and you get a liter, 1,000 milliliters of fluid, and then you can't get rid of it. So just a word of caution about that.
I'm just thinking about the backup. It's you just backed up. Oof.
I mean, that fluid is, if the heart can't pump it out, and if the kidneys can't pump it out, it's going to be bad.
It's a problem. Yeah. Well, yeah, we're going to talk a little bit about kidney health on Friday night. So hopefully you'll join me for that. That'll be a mini lesson around kidney health. That's it, y'all. It was 8:43. We went way longer than we thought, Ari.
We did.
Lady, we went almost 2 hours. Okay. Y'all are troopers. Thank you so much. I love y'all. I
Thank
just want
you.
y'all to know that. I love all of y'all. Thank you so much for being in this challenge. Thank you for showing up. Thank you for doing the work. Thank you for being each other's accountability buddies and just like cheering each other on. Y'all are wonderful. Y'all are wonderful and you're fine. Just continue doing your work. Let me say this. This is not a sprint. It is not. This is the journey of your life, a marathon of your life. The things that I'm doing now, the things that I did 10 years ago, I'm reaping the benefits of them with my health now. Period. The blood pressure stuff, we've been working on that for 10 years. 10 years. And now I'm seeing the fruits of that labor. So it doesn't happen right away. Know that whatever you're doing, it doesn't happen right away. Healing, the first step in healing is acknowledgement that you got an issue that needs to be addressed. And then a lot of the things that come after that is denial. You don't want to believe that that's the thing that you got to address. So you be fighting it for years and years and years until you have to confront it and face your fears and face your anger and all the other things. There's so much behind healing. There's so much behind it.
When I heard you say that, I'm sorry. When I heard you say that, Chef B, I heard recently someone say, look 5 years down the road. And for my case, I'll be 70 in 5 years. What I want my 70-year-old self to say, thank you at 65 that you did this for me. So I'm trying to make sure I'm doing it today. So my 7-year-old self will be happy. So when you said that, that's what attention. Yeah, I thought about that.
Yeah, you got to have a vision for where you want to be. I'm 51, almost 52 next year, next week, not next month, I'll be 52. And I'm thinking about the next 50 years. I know some people give up slowly. They're like, girl, I ain't trying to live that long. Some people say that. They say that in just being funny, but they're honest about it and the choices that they're choosing, right? So y'all have to have a vision for your life and you got to choose you. It takes time. It takes time. It takes time. All right. Ari, any last minute words? Anything you want to say to close out?
I think you all are doing amazing and keep at it. Should be proud of yourselves for even jumping on this challenge. A lot of people are they're just out there, and you are actually taking the initiative to change the trajectory of your health. And that is huge. You know, the people I see every day outside of here when I'm in clinics, and I'm like, it's so simple. You had just, so the fact that you're giving it your all and you're doing it now, kudos to you. Yeah. And thank you for having me. Thank you.
Yes, Ari. All right,
I
beautiful.
do have a question. I got one. We're getting ready to
Hurry
go
up,
another round,
Valerie.
y'all.
Hurry
Y'all ain't
up.
leaving. Y'all ain't
You
leaving.
gotta go,
Okay,
Hallie. Come
let's
on.
talk about sugar. How much damage well, I don't even want to phrase it like that. If you're like eating a piece of fruit, maybe a piece of fruit before bed, is that considered a no-no?
I mean, if you say a piece of fruit, that's not, I mean, at least it's a good sugar. It's sugar, but at least it's a healthy sugar. It's not, you don't have sucralose and, all these other sugars going through your brain. So I'd say go for it.
Got you.
What do you think?
No, I think that you should drink some tea.
But
Drink some
here's the thing,
tea.
but if you are so here's the thing that I found with my weight loss clients, that if you are craving something like sugar and you decide to reach for, I tell my clients, if you craving something sugary, you're going to reach for fruit versus a Twinkie, go on and get the fruit.
Yeah, get the
Go to
fruit.
bed.
Yeah, I agree with that.
Yeah.
And I also would say,
But if not, you're going to come back with a vengeance the next
yeah,
day and you're going to choose that Twinkie. So,
no, I agree with that. And I also say maybe brush your teeth because that
oh,
actually
absolutely.
brushing
Yeah.
your teeth actually helps to shift that sugar craving. Literally, brush your teeth because you're getting the sweetness from the whatever the toothpaste is made from.
Get it off your tongue.
Get it all and then scrape the
Break your
tongue.
tongue.
Yeah.
Get it off your tongue. And I've seen this countless times in myself and in clients. Once you break that sugar craving, it's gone until you reintroduce it again.
Yep.
But the remnants, one of the things is to get it off your tongue. Floss, get it from in between your teeth, because those are the little places that it hides and it still matters.
Yep. That makes sense. Yep.
Mhm.
All right. I gotta go. My family's like, what's up?
I know. Doc is like, where are you? I'm still at the spa. I
We
gotta
got to
go.
go.
Thank you for having me. Thank you.
Love you guys. Have a good night. Another great call.
Okay, good night.
Night.